Hi everyone, my name is Lynn VP of Post-Acute Revenue Cycle Management with Simitree. Thank you for joining me on our home health video series. And today our topic is going to be discussing the differences between Medicare versus Medicare Advantage plans and how that can affect the reimbursement for your Medicare certified agency. So first, let's talk about traditional Medicare, also known as original Medicare. And those are the patients who've turned 65 years old and have enrolled with Medicare, which includes both coverage for Medicare Part A and B. So as a home health provider, we are covered, our services are covered 100% by Medicare Part A. Okay. Now, from a billing standpoint, we would set that patient's insurance in the software to be Medicare, and we would bill those claims to Medicare. Now, on the other hand, a patient that has enrolled in a Medicare Advantage plan is different. A Medicare Advantage plan is also known as a Medicare HMO plan. It could be described as a Medicare replacement plan. It all really means the same thing. It means that the patient has decided to enroll with an HMO instead of traditional Medicare. And when I say a Medicare HMO, it could be Blue Cross and Blue Shield, United, whatever insurance plan that may be. So the patient essentially opted out of traditional Medicare and decided to join that Medicare HMO. So in that case, you would bill the patient's Medicare HMO plan. You would not bill traditional Medicare. And that's something we get a lot of questions on that because it can be quite confusing. So again, a patient who has a Medicare Advantage plan, you would bill that Medicare Advantage plan, whether it's UHC, Blue Cross and Blue Shield, Humana, whatever insurance it is. And your reimbursement also may differ when the patient has traditional Medicare versus a Medicare Advantage plan. Also note that a patient cannot have traditional Medicare and a Medicare Advantage plan at the same time. It's really one or the other. That's a big question that we also get. Also consider running monthly eligibility checks to ensure that you have the latest insurance information for that particular patient, since we know that patients often switch from one HMO plan to another, but they also go back and forth to traditional Medicare and Medicare Advantage plans. So for more information on this topic, please click on the link below and download our Medicare versus Medicare Advantage tip sheet. I think it's going to be a really great tool for you to be able to understand the differences in a little bit more detail. Really the idea is to make sure that agencies don't lose money. So again, if you have any questions related to this topic or anything about home health or hospice, billing questions, please feel free to shoot me an email or reach out to me. Would love to talk to you about all of that in more detail. Thank you so much.